I'm Dr. Sonia Gayete, a fertility specialist here at the Center for Human Reproduction. And as October is Pregnancy and Infant Loss Awareness Month, we wanted to create some space for a conversation around that, around pregnancy loss, around miscarriage. This is something that we see very often here, and not only in patients who battle with infertility and sterility, but actually amongst population. And I wanted to actually start with some context, because, miscarriage is something that affects 20 to 25% of all pregnancies. This is a very big number. This is 1 out of 4 or 5 women who conceive will actually just lose the pregnancy. Usually this happens early on the pregnancy, but it can happen at any time, and it can be as devastating. So it's something that happens really common that we need to be aware of. If we're in a room full of people and we ask how many people here actually suffered a miscarriage, there will be so many women that will raise their hands. So, this is something to really be aware of, and that's what we're doing in October. Strikingly, there's still a lot of silence around the topic. It's surprising, even to physicians, it's surprising that something that happens so often, that is so frequent in the population, it's still so silent. Women, fortunately, are talking more and more nowadays about their fertility issues, about women's health in general, but there's still a lot of silence around miscarriage. It may be because it's too painful to talk about. It may be because of shame, because of guilt sometimes. Feeling that it's your body that was not able to fulfill a dream or a hope that you had as a couple. Sometimes this can affect a lot deeply the self-esteem of a woman. Sometimes this also affects a lot the intimacy with your partner. It's hard to talk about. This we can understand, right? And yes, sometimes some patients explain that having a miscarriage even affects a lot the intimate moments with their partners. It may affect just the imaginary of a following pregnancy. It creates some rejection or aversion to even attempt to conceive again, or have fear to go to a fertility clinic, because despite being something that you really wish, it's also something that you're already rejecting because you have fear of another failure. So it's a roller coaster of emotions for sure, and it's a topic that we should be able to talk more. We should talk about it. It's important to talk about it, to open up about these experiences with the goal of healing. Maybe to your best friend, maybe to your sister, maybe to your mom, whoever would be your trusted person. As I'm saying, nowadays we are talking more even in other patient forums. If you want to do it in a more anonymous manner, there's lots of ways to share this, but it's important to grieve. It's important to grieve. And grief, as psychology has very well demonstrated, grief needs witnessing. Grief needs hearing, needs a validation, and that's the most important thing, that you are able to feel heard, to feel understood, and to feel validated. That's the most important thing. So if you're struggling with this, I would fully recommend for you to, have someone that you can open up to. If you are that friend that is there to hear, please do. Please just validate, whoever feelings. Don't go into false reassuring answers to your friends, like, oh, don't worry, this is normal. Don't worry. Of course they're worrying. And of course, even if having just one miscarriage may not be medically concerning or not necessarily mean that it's going to happen again, this should not be a reason to invalidate the feelings of whoever has experienced it. So always be there for your friends if they are opening up about this. Just be there. It's the easiest way to help them is to actually just hear them and validate their feelings. So yes, the question here would be, how do we heal from this? How do we heal from the fact that we had a pregnancy loss, that some dreams of family building maybe crashed, that maybe we're having, now shame with our partners, our families, that we don't want to, explain this. How do we heal? Well, especially if we have already had many miscarriages, this is obviously worse when patient is dealing with recurrent pregnancy loss. It can become a especially tricky situation. Talking to patients and to psychologists, we've realized that There are many ways to sort of grieve. Sometimes rituals can help. There are many patients that explain that when they had their pregnancy loss, something that helped was to give some space for a little ceremony, a little funeral, put a candle, just maybe have a memory box with the baby's ultrasounds, with, maybe some pair of shoes that you never end up using. Things like this, having a memory box many times just helps make it real, give it space, give it context, contextualize this in your life story and make it beautiful. It's a life that didn't make it, but it was part of you and your partner, and it's a beautiful thing, even if it didn't end up as we were all hoping for. So that would be another thing. Even just sometimes just naming the baby, not just that miscarriage or that embryo that didn't make it, but actually naming it also sometimes gives a meaning to what happened and helps with closure. And I think that is really important for healing. So yes, I hope that just with all these little concepts and ideas that I throw to the table, we're all a little bit more aware. That's what we're trying in this month of October. All right. Have a good day.